Our first presenter is going to be Miss Cheri Holden, and she is the newer, she's been here for a little bit, Health Department Manager. So let's give her a warm welcome. And I'm going to get your presentation up. And Miss Cheri, you just let me know when you're ready to change slides, and we will do it that way.
Well, thank you. I'm Cheri Holden, and I've got 27 years experience with Cobb and Douglas Public Health. So I've done public health for a long time. I'm real happy to be here and enjoy looking at public health in a different way. It seems like more down there it's more metropolitan, and up here we're back to rural. So I have enjoyed it a lot. I have really missed doing what old public health used to be. So it's great to be here. The Pickens County Health Department, we're basically here to promote, protect the health of the people in Pickens County and wherever they live and work and play. That's our goal with what we do. The Pickens County Health Department is an integral part of the quality healthcare system for Pickens County, and we provide core public health services. And basically that's what I'm going to do this morning, is just give you an overview of our services, and then we're going to expand on WIC and go into detail what WIC does. That's our focus mainly for this morning. These are just a few statistics. Oh, I guess they're good enough. A few statistics that our district office came up with that we thought that people might be interested in knowing. But Pickens County population, based on the 2013 estimate, was 29,584, and the median age is 42 years old in this county, but 35 for the state of Georgia. The median household income is a little over 51,000. The unemployment rate as of December 14, 5.5%, which that's overall. And in Georgia it's 6.9 and Pickens is 9.9 as of January 13. Basically the income of people's employment in this county is construction, public administration, education, and motor vehicle and parts. And we were ranked 31 in Georgia for health outcomes. In 2013, we were 32. So I guess that's a little bit of an improvement. But these are the things that are highlighted as issues that we need to focus on and try to get that rate better. The health department has 15 people employed between the clinic and environmental health. 15 staff members. Our first clinic that we're going to talk about is our women's clinic. And basically in this clinic, it's a comprehensive service for well women. Most everything we do is preventative. That is our goal, is prevention. We do physical exams that include pap smears, breast and cervical cancer screening, women's health education, pregnancy tests and referrals, and perinatal case management. We have several children's clinics. The first one is basically, here again, like prevention, and it's for birth to 21 years of age, and the goal is to, just basically provide preventative care. Some of these preventative care services that we provide are complete well child physicals, immunizations for children, immunizations for the caregivers for children, hearing, vision, and dental screenings for the school system, and a car seat education program, and we provide actual car seats for families that are in need. Another one of our programs is Babies Can't Wait, and this program is an early intervention program for infants and toddlers. It's basically for developmentally delayed and disabilities, and it's to help their families with children with special needs. It is a referral program, and the main office is in Dalton at the district offices. We can do referrals through the Pickens County Health Department, though, to get you to where you need to go if there is a child that's identified that needs this service. Another program is Children's First, and Children's First identifies children who are at risk for poor health and developmental outcomes, so that referrals are given to them and to help the family function better in the home, and so that the child can grow up and not end up being developmentally delayed. That's also in the Dalton office, but we can get you in touch with who you need to be in touch with and do whatever needs to be done to help get that referral taken care of. We also have children's medical services, and these are for families with children that have medical needs that are unaffordable on their income. That would be like hearing, neurology clinics, cardiac, plastic surgery, orthopedics, and follow-up to burn care. Those costs can get extremely expensive, and a lot of the families don't have insurance and cannot afford those special care that they need for their children. The next slide is on our WIC program, and it's basically just an overview for the WIC program, so I'm not going to really go into that because they're going to talk to you about it and give you all of the details. But they provide a lot of services. They provide education and healthy nutrition and food and recipes. It's just, the list goes on. So she'll talk to you about that. The health department worked with our school system in 2013 with a project to become tobacco-free. And it was a CDC grant that they got, and it was a great project. It's going well and working well. So our schools and health departments and everything are 100% tobacco-free now. We offer immunizations at the health department. Those are basically children and adult immunizations, like for flu, preventable diseases, all the state required vaccines for school registration, and for school and college, and elementary school and college, and for whatever you need. We don't actually do too much travel vaccine. They do that in Gilmer County. That's where our main vaccine clinic for that is, for travel. We also have the Infectious Disease and Communicable Disease Department, and basically they work with people that have TB, hepatitis, HIV, norovirus, Lyme disease, Giardia, pertussis, salmonella, rabies, anything that's reportable. They will help investigate, get everyone that has come in contact with treated, and get them in. They will monitor the outbreak and the and try to control to close it down so that it doesn't continue to spread. We also do sexually transmitted disease clinic, which would be chlamydia, syphilis, gonorrhea, HIV, counseling. We do referrals, partner referrals, and help anybody with that. Another program that we have is the Living Bridge Center, which is basically for our HIV clients. It is a complete care for a client that has been diagnosed with HIV. The main Living Bridge Center is in Dalton with the district, but we also have a small satellite in Gilmer. These people would have to go to Dalton to get started, but if they lived in this area, they can be referred to the smaller clinic here in Gilmer to maintain and do their ongoing care. But it pretty much covers everything. It's medical, it's management of their mental health, their substance abuse, counseling, anything that they need. They can be linked to the service that goes along with having that disease. Another department is environmental health. It provides a lot of services to the community. It inspects, it has to do with tourism, restaurants, swimming pools. It does all of the tattoo parlors, body art. They check, they do septic system permits, investigate for mosquito-borne diseases, and rabies testing. So it has they're very busy staying on top of everything in the community to try to keep it a safe and healthy place. Our other department is emergency preparedness, and emergency preparedness, its local plans are in place to respond to terrorism, natural disaster, and other public health emergencies. It's ongoing in the county, and we run simulations every so often. So when we do our flu clinic shots every year, that is kind of like a dry run if we had to set up a distribution center or provide a service in the community due to a terroristic attack or anything else. We have many community partners, the city, the county, the government, law enforcement, hospitals, healthcare facilities, schools, business. Everybody works together to make this project work to keep our county safe. The health department, unfortunately, is not free anymore. Nothing in this world seems to be. But most fees, we don't turn people away for inability to pay, and most fees are on a sliding scale, and we don't refuse services or deny services because of income, race, ethnic background, religion, county of birth, gender, or gender preference. If someone comes in and they need something, we will work with them to see that they get it done. I mean, we're not going to be able to just say it's free, but we're not going to refuse service if someone truly has a need and needs to have it done. The next slide is just basically our hours, and we are there every day. Tuesdays are our long days to try to provide after-hour services for people that work or in school or whatever. And then Fridays are a shorter day. Environmental health is out in the community every day but Monday and Friday, but you do need to call for an appointment with them. And the last slide for me is our website. If you'd like to learn more about things that we do or get in touch with any of us or whatever. I have also given you a flyer. Our newest project is to try to help people keep their employees healthy so that they stay at work and don't miss work and don't come down with different things. So we can come out to your place of business if it's easier to do your skin test annually, once a year. If they need Tdaps, which are the tetanus with pertussis in it, to keep them well, or Hep B, Hep A, anything that your company or your business requires. We can come to you, set up a day, come to you. We bill most insurances. If the company wants to pay for it, we can do it in one lump billing, or however. We did the same thing with flu shots, and we did a lot of businesses, and it's just easier than trying to get them all over to the health department and giving them time off of work to do it. It's just to set up a time and run through. So just realize that we're here and that we are willing to do that for you, and we can come to your place.